welcome to our session on effective leadership requires making people feel safe. My name is Diana Rodriguez, and I will be co-moderating with my colleague, Dr. Elizabeth Muhirantaki. Let me first introduce my co-moderator. Dr. Elizabeth Muhirantaki is a physician administrator at WellSpan who is completing a healthcare MBA. She's the medical director for quality and innovation, as well as chair of the Department of Family Medicine. She's a clinical professor in the Department of Family and Community Medicine at Penn State College of Medicine and has a very strong passion for service. I am a maternal fetal medicine specialist currently completing an MBA at GW with a focus on management leadership and have served as director for practice standards and safety. I've mentored many current and future healthcare providers across multiple disciplines. In fact, now that our technology does not limit our reach, I currently mentor a group of physician teachers from Oman. I strongly believe in the power, in our responsibility to empower our teams to see themselves as agents of change. So today's subject is very close to my heart. So in terms of, we're kind of on a time crunch here because we're running a little behind, but I'm going to just provide kind of an overview. We're going to be performing a quick survey. So if you can all go to your phones or devices and go to menti.com and enter the code 861203. If you could do that now, that would be great, so that we are ready to launch. Just wanted to say that the COVID-19 pandemic has really challenged our sense of safety as well as that of our families.
Diana,
yes.
Why don't you put it on the chat section so everybody can see it? Yep, Jennifer,
Great.
thank you.
Actually, can you, Elizabeth, can you put it in the chat section for me, please? I don't have that part up. And so today's session is really, we're going to be talking about how we as leaders can help our teams feel safe. We have a great panel that will help you think about what you can do, and I have a challenge for you. At the end, I will ask you to write in one thing that you will take away from today's session, so please remember that. Before we go, we'd like to perform this quick survey. The first question here, are you a leader? Please go to www.menti.com and use the code 861203. So I want us to enter these pretty quickly so we can make it through the session. They should be fast. This one should be particularly fast since I only gave you one choice, meaning that we are all leaders and everyone is, there's been a common theme today that everyone is looking at us at all times to lead. Next question, I feel psychologically safe at work. I feel that my institution hospital has done a good job handling COVID. I feel anxious about COVID. My managers or leaders have asked how I am doing. I feel comfortable sharing my fears, needs, and questions with my managers and leaders. My staff feels psychologically safe at work. My staff feels that my institution hospital has done a good job handling COVID. My staff feels anxious about COVID. I regularly ask my staff how they are doing. My staff feels comfortable sharing their fears, needs, and questions with me. So as we can see from our answers to these questions that should be all yes, 100%, we have some work to do. And that's why we're here today, to learn about what we can do to make everyone feel safer. So today we're going to hear first from Dr. Rich Salter. He's a family physician and medical director for quality and innovation for WellSpan, as well as the chair for the Wellbeing Council. He will share insights on how his organization has proactively helped build wellness within their workforce and how they have supported each employee during this crisis. He believes that workforce safety is a key component of organizational strategy. Next, we will hear from my classmate, Dr. Janice Blanchard. She's originally from Chicago, and after completing her MD and MPH at Harvard, went on to train in emergency medicine at George Washington University, also completed a PhD from the Rand Graduate School in 2006. She's been, as a frontline worker and academic leader, she's been outspoken about the emotional toll of COVID-19 on all providers and the additional impact on providers of color whose communities are being disproportionately affected by the pandemic. So we will hear from her some insights about what leaders can do to mitigate the mental health effects of the global pandemic, as well as the fact that safety is influenced by the global social inequities that are only exacerbated during crisis. And last, but definitely not least, you will hear from Dr. Peter Pronovost, who's a world-renowned patient safety champion, critical care physician, researcher, and global thought leader on US and global health policy. His scientific work leveraging checklists has saved thousands of lives. He has, sorry about that, has been named as one of the 100 most influential people in the world by Time magazine, and has been regularly recognized as one of the most influential executives and physician executives in healthcare. Dr. Pronovost will share his insights on how, by improving the team's psychological safety, you also improve its operational success and ultimately patient safety. So I'm going to turn over to my co-moderator, Dr. Elizabeth Muhirantaki.
Thank you, Diana. The first question is going to go to Dr. Salter. Dr. Salter, WellSpan's response to the COVID-19 crisis was fast and was swift. It included strategies like allowing physicians to wear PPE very early, mental health resources, and encouraged physician leaders to check in with the physicians that they support. Can you share a rationale about why this was important to WellSpan Health and the strategic value of these actions?
Yeah, thank you, Elizabeth, and thank you all for having me in this important discussion. I would say what drove most of our decisions early in the pandemic was to ask ourselves the questions: what impact is this pandemic having on the health and well-being of our physicians and APPs, especially those frontline healthcare workers that include even, well beyond the physicians and APPs, but our nurses and our ancillary staff. So that question really drove a lot of what we were doing. So early on, we set up an incident command, and we had daily check-ins about how we were doing with things like PPE. Did we have enough? And did our frontline know that we had enough? And were we going to be able to have the right masks and educate them in the proper equipment to keep themselves safe in the caring of these very sick patients? And so that was part of it as well. We also had daily check-ins as to how we were doing as far as capacity, ICU capacity, and that started us thinking, if we max out capacity, will we need to redeploy and do more of an all hands on deck approach? So that was important early on. The other thing we recognized early is just a huge mental health component of this response to the pandemic, of making sure that our frontline healthcare workers especially knew what the issues were and that we were doing everything we could to keep them safe. So real early on, we instituted multiple means as the way to communicate with them. We had a daily email on the important topics. We established Monday, Wednesday, Friday, noon hourly calls that were by our administration, specifically addressing the physicians and APPs, although staff did join in on that call. And then we would have a question and answer session to help them navigate the questions that they had. We immediately made a well-being moment part of just about everything that we did, and we expanded our EAP services. We made our behavioral health colleagues available for one-on-one phone calls by way of a physician or an APP hotline as early as March 24, so our healthcare professionals could have access to them. We emphasized an app that we call My Strength, for which they could go to for additional help. And we even made available what's called a pandemic survival guide at a discounted rate that we were able to get from my colleague Dyke Drummond at the happymd.com. And that really helped them navigate what to expect with the pandemic coming down the pipe. There's many layers of this. That, along with our redeployment efforts, we knew early on we had to get other people ready and prepared to provide inpatient care. And we did it based on their training and willingness to go from an outpatient position into inpatient care as we moved our hospitalists potentially up into our ICUs. We encourage regular check-ins by our leaders. I, for example, started a once a week call with my site directors, the 15 docs of my lead practices, and we started with data and then gave them a chance for a 1 minute report out what was going on in their practice. And themes would emerge, and then we'd be able to take that back to administration. And then lastly, we tried really to keep our ear to the ground. We put out a pandemic survey in April, asking questions like, how can we support you at this time? And from all of their answers, we came away with things we should start doing, things we should stop doing, things we should continue doing, and things that we should clarify. So those multiple efforts, I think, allowed us to have a successful pandemic response.
Now, looking back, now that we've come so many weeks into the pandemic, is there anything that your organization has learned from this or would have done better?
Yeah, I think what we learned is continue to ask ourselves that question of what impact is this having on our health caring professionals? It's so important that the folks at the front line can't deliver great care if they themselves are not well. And then also recognizing that with uncertainty, there just becomes a great need to communicate regularly. And so that's why we kept up the noon calls. In fact, to this day, while things have calmed down in Pennsylvania, we only do the noon calls once a week, but we think that that's likely something that we will continue going forward just as a means of communication and then a means of question and answering. So that's something that we felt really worked well. What did not, the feedback we got was, don't talk so much about finances. Don't make us feel that finances are more important than our own health and well-being. And the other thing that we could have done better, I think, is by communicating the redeployment a little bit better. Once we tabbed some people that they were up for redeployment, even though we only had to redeploy a few folks, it was very anxiety provoking. So I think we could have done a better job communicating to those who had potential redeployment. The things we would have changed, I believe, would be more of the Zoom calls that we were doing for our physicians and APPs. We would try to do that with our staff as well, because there was some anxiety amongst staff as they weren't getting all the information quite like our physicians and APPs were. And then just visibility. The leaders needed to be visible and checking in regularly. And I think that's something we did well, but probably could have even done even more regularly.
Thank you very much. That is very helpful and very insightful, especially about the visibility of the leaders during a crisis. Okay, thank you, Dr. Salter. The next one, Dr. Blanchard. Crisis usually accentuates the inequities that exist within our most vulnerable populations. This pandemic has hit very close to our hearts, to the hearts of providers of color. And this was in your publication that just went out. In it, I will quote what you said: our hometowns are the sites that are facing some of the largest tolls of COVID-19. When a Black, Latinx, or Native American person under investigation for COVID-19 comes into the emergency room, we not only see a patient, but we see our mother, father, aunt, or uncle. So from this, can you please share with us your thoughts on how we keep providers of color physiologically, psychologically healthy when they have to deal with the fact that their communities are being differently affected?
Okay, well, thanks. First of all, I wanted to thank you for having me on this panel, and nice to be on a panel with all of you. I want to first start off that I'm an emergency medicine physician, and the most important thing in the work environment, just like any physician, regardless of background or race, is just feeling safe in your environment. So I appreciate some of the things Dr. Salter mentioned. For us, having appropriate PPE and knowing that people are looking out for your safety, that's first and foremost, no matter what. If you don't have a safe environment, your mental health is impacted. And not only PPE, having cleaning supplies, you know, and also having gowns and things like that. We were all have been financially impacted by this. So we definitely had issues with staffing. So we had that double-edged sword of having the financial impact and having now this need for all of this extra protective equipment. And every patient now takes so much longer than before. So first and foremost, that is important. But definitely as a person, as a physician of color, another thing that was very important for me is also knowing that where I work, we cared about our communities. You know, that is a big thing for me. And also it's important for leadership to also to have some level of community engagement. So that might mean going out and participating in testing. GW is very active in local testing and things like strike teams. We go to nursing homes, we go to some of the jails and do all of that. To me, that's actually really important to know that my institution also cares about the community in which I work. So I would emphasize that although we need to care about the physicians at the workplace environment, for me, it's also important to know that we are engaged with the people that we serve as well. So in terms of any special strategies for communities of color, I don't have any particular. I think that there's a lot of stigma with mental health, use of any kind of mental health resources. I'm not sure how much people actually use. I haven't personally used any of the mental health resources we have at GW, but just knowing that they're there is important, and that stigma might even be more common in people of color. So I think that's something important to think about when you think about approaches for people. For me, the support at the workplace and support of our community are the two most important things.
Okay, thank you, Dr. Blanchard. Is there anything in particular that your healthcare system did to make these healthcare workers feel safe? Anything that was very unique to the ER at GW?
I mean, I don't know necessarily. I mean, just little things, honestly. You know, we literally will have a mask on for the entire 8 and sometimes 12 hours for residents because there was a shortage. So for me, just having the PPE, they'd have food for us. I mean, just little things that you may not think about were actually really important. So I don't think GW necessarily did anything unique, but just having the proper PPE was a big, big thing for us.
Right, thank you. Because yeah, I think proper PPE was a huge source of anxiety for a lot of frontline workers during this pandemic. So thank you very much, Dr. Blanchard. Dr. Pronovost.
And I will add, just come off of an, okay. I was gonna say that I don't think this is over, and I think we can't be too complacent. We saw several cases last night, so I think that this isn't over, so we have to realize that.
Right, thank you. Dr. Pronovost, when the pandemic first hit, there was widespread panic among the frontline healthcare workers when they realized that there was insufficient PPE, or at least there were a lot of reports in the media of insufficient PPE. A lot of workers felt very unsafe, unprotected, and powerless, especially physicians who are working in the hospital and those who are particularly employed by hospital systems because they had to rely on somebody else to obtain this stock for them. My colleague, Dr. Diana Rodriguez, recently co-wrote an opinion statement titled, "Why Good Enough is Not Good Enough. Scientific data, not supply chain deficiencies, would be driving CDC recommendations," where we argue that making the distinction between optimal and what's good enough under the circumstances is critical because it prioritizes the urgency of acquiring optimal PPE. So with this, can you please share with us what the PPE status of the institution was and what the feeling among the care teams was at that time?
Yeah, great. And, this is just a unique combination of circumstances because what we had with COVID was the alignment of high urgency, high risks, and high degree of uncertainty because the epidemiologic data of what PPE was even needed is, it's still evolving and maturing and to the degree to which it's aerosolized. And the supply chains were in short course. So there was this, huge confusion and fear and I think often got presented as an us versus them, where many clinicians felt that their leadership either didn't want to spend the money for the PPE or there was some withholding of PPE. And there's many examples that are around the country. On the other hand, executives, for the most part, I believe, genuinely making a sincere effort to get this PPE. The supply chains were just uncertain, and even the communications in the supply chains were really chaotic. And so what happened was it became poised of clinicians feeling rightfully so, they're being put at risk, it's unsafe, I'm uncertain, and took that out on or looked at executives for leadership, and many leaderships didn't know. And so how could that have been approached in this leadership communication? Well, I go back to, in this trying situation, leaders' roles are to provide protection, direction, and order. And in this particular situation, it requires this unique balance of being realistic and optimistic. And in that case, I think there was plenty of opportunity for more realistic communication because, as you know, much of the recommendations from policymakers, be that the CDC or state health departments, were less based on science, or perhaps in part based on science, and a large part based on practical availability of PPE or testing. And acknowledging that to say, well, the evidence didn't change, its supply chains we're putting our risk benefit thresholds at a different level, and having that authentic conversation with staff. And at the same time, acknowledging that they're doing everything and assuming that's sincere to, get these supply chains, because as you probably know, the supply chains just exploded. And so there was disruption of them. There was a lot of gray market or black markets stuff coming on the market. Hospitals, it was just a frenzy of trying to get the PPE equipment and even what was needed, and, rumors or lack of clear communications of when it's going to arrive. And my sense is leadership 101 is to say we need to give a realistic account and why we're making these decisions. If it's not based on changing science, it's based on availability, then we need to have that conversation. And then finally, authentically listen to the concerns of the employees who are, doing heroic work. And I liked that op-ed piece that you said, because if I had one plea for the US healthcare system is, yes, we need to acknowledge our heroes, and we're so blessed that we have them, but we needed to design a system that next time we're not reliant on heroism, but we have robust supply chains and much more rapid evidence summaries, so we're not in this position again.
Thank you. Thank you very much, Dr. Pronovost, for sharing with us. And so since we are a little bit time short, are there any questions from the audience, Diana? Any thought-provoking question? We'll probably have time for just one question.
I think we'll go straight to what I'd like to hear from each one of you in like 30 seconds or less, so 1 or 2 sentences max, is basically, as we look now to, first of all, this wave isn't over and we have a wave that's coming, is what is your take-home message to everyone that's listening? If there's one thing you'd like them to take away from today, is what can they do to prepare?
Dr. Salter?
Yeah, thank you. I would probably ask 2 questions. Continue to ask yourself, how is this continuing to impact the health and well-being of my frontline healthcare professionals? Keep asking that. And also recognize that as uncertainty increases, you need to communicate regularly. So communicate regularly and be visible by way of multiple venues to your health caring professionals.
Thank you. Dr. Blanchard?
I think first, protect and look out for your frontline workers, but also invest in your community. That would be my message.
Thank you very much. Dr. Pronovost?
Yes, thank you. I would say 2 pieces. One is bring authentic communication about the current situation. Hopeful, yes, but authentic, and that includes your vulnerabilities, the inequities that are real, and discuss those. And second is, don't lose the adaptability that was just brilliant in this. I mean, organizations made changes in a week or a month that they've been trying for years, and there's some really good innovation and adaptions that came, and that adaptability or agility will serve healthcare well in this uncertain future. So think how you could maintain that organizational culture.
Thank you. Thank you to all the doctors. Diana?
So I really want to thank everyone today for joining us. I'm sorry that our session is kind of cut a little bit, but I wanted, for me, this has been really helpful to hear from all of you. I heard such great things like celebrate your successes, vulnerabilities, authentic communication. Those are all really, really important. And I think one of the things that breeds a lot of fear is lack of authenticity. When you can't trust the people that are leading you, the people that are making decisions about you, that really shakes your foundation. And I want to thank all of you for joining us. I want to also thank my team. This is my psychological safety team who really helped us put this part of the conference together. And I want to share the words of Amy Edmondson with you. You may not know who she is. She's the person that really kind of coined this term. Not that she invented it, but she brought it sort of to light so that we started having discussions about it. And that psychological safety at work really does take effort. It's not the norm, but it's certainly worth the effort. And the fact that you are all here today means that you're willing to go outside the norm to make your teams feel safe. And I want to really thank everyone for that. Now, remember, I told you that I had one challenge for you. I wanted you to think of at least one thing that you're taking away from today's sessions that you heard from the speakers. And I want the speakers to participate in this too, because you've all been listening to each other as well. And I think it's really important for us not to practice in silos, but to communicate across institutions. So if I can have you guys go back to your devices, we'd like you to help us start our Promoting Safety Toolkit. So if you go back to menti.com, can you please type in at least one thing that you will take away from today's session. I'm going to do the same too. So you can see the magic happen. All of us heard similar things, different things: authenticity, communication, resiliency, checking in, community. Keep putting them in. I heard realistic, optimistic. So thank you, everyone, for joining us, and you can continue entering your take-home points, because I love seeing the magic happen on the screen. But I want to say that your teams really need you to lead, and they need you to make them feel safe. And that's not to say that we have to have all the answers, and it's hard when we don't we're so used to trying to answer questions, and it's okay to say, I don't know, but you still need to lead. And I thank all of our panelists for giving their insights into how we can do this to keep our teams feeling safe. And I hope that you took something out of this. And I want to thank Dr. Elizabeth Muhirantaki as well for co-moderating with me. And clearly ICSB for helping us put this together. Thank you.
Thank you.
Thank you, everybody. So we're going to stop now and then ask you guys to join us back, to exit and come back in again for our next session. Thank you again, everybody. Thank you, Elizabeth. Thank you, Diana. Just absolutely amazing. Thank you.
Thank you. And thank you to our panelists.